We asked a number of our senior American mental health clinicians to discuss their professional working experience in New Zealand, plus the associated lifestyle factors they encountered. Here's what they had to say.
I usually describe it to people as a sort of kinder, gentler, and probably somewhat more effective VA system.
Yeah, I think there's a lot more ability to do creative and flexible care. Like, my residency training, I think I went to a patient's house maybe once or twice in 4 years, and now, it could be once or twice a day or once or twice a week, that will go out to patients' houses, with this sort of community outreach service, particularly as a service that's designed to kind of work with people where they are, rather than trying to fit the person to the system. The system is more flexible and can kind of fit themselves to the person. It's
a country of 4 million people, and they spend less per healthcare dollar than the U.S., than the U.K., but by every rating system by the WHO and the OECD, they rank very highly in terms of equality of care, efficiency of care, high quality of care. In Auckland is the referral center for the South Pacific. You get patients from Samoa, the Cook Islands, Tahiti, and sort of places around who come from really interesting and unusual cultures, and they have actually sometimes quite challenging disposition.
The country's bicultural, with it actually seems to be part of the Constitution. The Maori culture has to be side by side with New Zealand European culture, and so you're just exposed to that all the time.
Right.
And like you said, they're just people from all over. I've been working in community mental health setting, and now I'm in like an inpatient residential psychiatric rehabilitation setting, and every hand over the shift, we start with a song. So people pull out the guitar, we get the song books, and so you learn how to sing, and learn some Maori songs. So the diversity too within the staff is incredible.
Yes.
I work with people from South Africa and India and all over. A lot of people from the UK, people from Southeast Asia. So it's just day-to-day life is incredibly diverse here.
So it's kind of okay that, I'm American, I don't really know the culture.
Right.
People are like, that's fine. Well, if there's someone who does, and we'll help you.
Yeah.
And I never feel like I'm the one who has to figure it all out. There's always someone who knows.
And medications, when I was coming over here, I thought, wow, that'll be interesting. I imagine that you're going to be straitjacketed and you won't have as many medication options to choose from. And, pretty much everything I used on a routine basis in the States is available here. You might have to go through some different steps to get there. But also there's a whole bunch of medications that I'd never even heard of before that are available in other countries. So, I'd say there's probably as many medications available. It's just some of them are different.
You never have to worry about, well, does the patient have insurance? Can I recommend this treatment? Can I send them to this? Can I prescribe that? It's like you never have to chase that down.
Yeah. And all these different specialty services are available because they're publicly funded specialty services.
Right.
Yeah. Definitely there's a lot less in community mental health setting, an expectation that you're not going to see as many patients as you would in a U.S. Mental health setting. Like a community mental health setting in the U.S., I'd be booked for 24 patients a day, 20-minute slots all throughout the day. So,
and how many do you see here?
Here, probably, it depends. It could be like 6 to 8 people. Yeah, it sort of depends on the day and how intensive something is.
That's my experience too.
Yeah.
My schedule is very manageable here.
Yeah.
It's because there's less legality and less liability. I'm pretty sure we all use the same malpractice insurance, which is around $1,000 New Zealand a year, or $1,000 U.S. equivalent a year, and the hospital pays for that anyway.
Yeah, and it's not really malpractice like we know it at home. I mean, they don't really sue doctors the way they sue them at home. I mean, I guess there's...
Well, you can't. Yes, there's no liability. You can't. There's no sort of pain and suffering
Right.
liability. You actually have to demonstrate that the doctor's negligence led to a distinct harm that you experienced or that impacted you.
Right.
Is that my understanding? You probably know more than I do.
But the bottom line is it just doesn't really happen very
Yeah.
often. I mean, the doctors here are not thinking much about medical malpractice
No,
in their day-to-day practice of medicine.
No, that's very true.
Yeah. The continuing medical education package
Yes,
is
true.
quite generous.
No,
I've
right,
had a
right.
nice trip to Australia on my continuing medical education. I'm going to spend a week in Tahiti in 2 weeks learning about suicide in Pacific Island populations. And I mean, that's an excellent perk of working here is they know that their doctors have to travel a long way to get to see me, and they provide you the resources to do that. So
Yeah.
that certainly doesn't happen at home.
Another thing that I haven't seen so much, particularly working in, definitely in private practice or in kind of for-profit settings, or even in a lot of, tight budget community mental health settings in the U.S., the expectation that part of your work day is going to be continuing education.
That's true.
There's these different figures of 20 to 30% of your time is supposed to really be non-clinical time. Because when I've worked in community mental health centers, basically, it's tough to get lunch sometime, let alone to say, I'm going to read a journal article or I'm going to go develop a talk or, whatever it is. So it's a different sort of philosophy that part of your work is actually the continuing education instead of it's something that you do after you see all your patients and go home.
It's taken me a while to sort of stop working American hours.
Yeah.
And actually, when I first got here, the thing, I would say the most illustrative thing is the thing that drove me crazy, which is, you really need to have an FPOS card, the ATM cards, in order, because you buy everything with it instead of cash. And you need a mobile phone here. And I kept not getting to the mobile phone store before they closed at 5:30 and getting to the bank before it closed at 5. And it was just driving me crazy. And then I realized that it was actually me. Like, I was the one who was working till 6, and everyone else was finishing up earlier than I was.
It is hard transitioning here if you're American because you have this feeling like we should be doing more. And it's not that work doesn't get done. I mean, the staff that I work with, the nurses and social workers I work with, are extremely professional, capable people. They are on the ball. They know what they're doing. And stuff gets done. But, just the expectation is, well, of course, if your daughter has a cricket match, you're leaving to go to that. You don't need to make a big fuss about it.
Or if your child's sick, it's okay to say my child is sick. Now, you don't have to call and say, oh, I'm not feeling well because you need to take a sick day because your kid can't go to school. Well,
Right.
of course you would stay home if your kid's vomiting and ill.
I think that's one of the just incredible things about living in New Zealand is it's just such a diverse, beautiful place. And, you can even go out in the ocean, take a cruise, go whale and dolphin watching, go out to some island where they're doing, restoration of natural habitat and natural species. In Auckland, you can go up in the Sky Tower and be in sort of a downtown urban environment. You can go out to mountains and hills and so many different diverse things that you can travel to very, very
And that's just
easily.
Saturday.
Yeah, right. That's just one day. I mean, that could be right.
Yeah, it's just the natural beauty here is unbelievable. I've traveled a lot, and I know you guys have traveled a lot. There's nothing more beautiful than New Zealand, really. And combined with the attitude that the Kiwis have about, the way they feel about balancing work and family, and they also really value being outside. It's an incredibly sporty country with incredibly fit people. So there's all sorts of things to do. I ride my bike along the waterfront to catch the train and take the train the rest of the way to work. And it's such a great way to get to work. So the schooling has been one really great surprise for me because my daughter's in primary school, elementary school, I guess we call that at home. And the quality of the education she's getting here is amazing to me. Her mathematics has just progressed like crazy. I mean, the quality of education here is really good. She walks to school. It's completely safe. You know, we just live in such a safe neighborhood. She walks to school with a couple little friends that live on the block. So she just loves her independence. Her teachers are fabulous.
I was really surprised how easily my credentials transferred over here, as far as actually just getting a job. For being able to pick up your life and move to another country and have all your credentials transfer, it did take a number of months just getting all the paperwork together and all that. But for the most part, it was a pretty smooth process.
There are opportunities to work here for different lengths of time. I think you can work here for just 3 months, even, but 6 months.
3 months it would be.
It would be a lot of.
It'd be a bit crazy.
It'd be a lot of trouble for 3
In
months.
medical tourism.
Yeah.
Yeah. But you can do. You don't have to make a lifetime commitment to come work here. This is my second time to come, and I've come for 12 months both times, just because that felt like a good amount of time.
Want to ask our clinicians a question or make a general inquiry? If you have any questions for our American clinicians around their New Zealand work and lifestyle experience, then email us on enquiries@mentalhealthjobs.co.nz. Or if you would just like to initiate contact to explore opportunities in New Zealand, simply call Anna at Auckland District Health Board on ++64 96 380 364 New Zealand time, or email nac@adhb.govt.nz.